our class. And so we've listened to a comment of the senior doctor about the ward round.
Unit 3.
So, yes. And now let us focus on some procedures. Yes, Swat.
Good morning, doctor. Sorry I
Good
was
morning.
late for class.
Why didn't you come to the first class?
I was having issues with the Wi-Fi.
I see. Is it okay now?
Yes.
Okay. Well, now, let us look at this slide and the question. Why do you need to do these things before you carry out a procedure? Obtain consent from the patient for the procedure. Consent is an agreement. So this is like some legal requirement before a doctor carries out a procedure. So the patient gives the agreement commonly in a written form that so he has the information about procedure and he's informed about how the procedure is done and why it's done, all kind of details about this. So why do you think you as a doctor need to obtain consent from the patient? Yana, what do you think?
Can you repeat the question, please?
Why should a doctor obtain consent from the patient for the procedure?
Obtain consent.
I've already said that consent is the patient's agreement to the procedure. Why should
agreement of course, because if otherwise it will be illegal. They should not do something with not of like agreement of the patient. It's his right or her right to agree on everything that will happen to their bodies, because at the end of the day, it's their own health and own body.
Yes, and the doctor only offers the procedure, explains why it's necessary, but it's for the patient to make the final decision about this, because you are right, this is his or her body. Okay, thank you. And Ramil is joining us. Why is it important during the procedure to introduce yourself and to prepare the trolley? Yosif.
Can I answer, doctor?
Who is speaking?
Doctor, maybe to communicate with the patient will be better, and maybe the patient will be he will feeling safe, doctor.
Yes, sometimes the patients are scared of procedures.
Yes, as you know, the patient maybe he will be nervous or something like this. If the doctor introduce himself, maybe he will feeling safe or like this.
Yeah, okay. Well, and preparing the trolley, why is it important? So is Aisha here?
Yes, doctor, I'm here.
Why do we need to prepare the trolley, and what is the trolley for?
Because some cases the patients are not able to walk, or
This
they
is
feel a pain?
another kind of trolley just for the doctor to just
For the food or for the
no, for
analysis?
equipment which can be used during the procedure. Equipment, some tools, instruments, medical instruments. So before the procedure, the doctor prepares all the instruments, all the medications, just put them on the trolley and moves the trolley into the ward.
Okay, now I got it. Because maybe there are a lot of the things or a lot of the drugs she will take with her, and she used the trolley to move another to move for rooms, because there are a lot of the drugs or a lot of the medications she will take with us. She will take with her.
Okay, so this is just to have everything on hand, just prepared, not to forget something.
Yes.
Now let us have a look at the sentences that describe a procedure. These are instructions for a procedure. We don't know what kind of procedure it is. We'll speak about this later. Now let us think of which verb is better to use in each of the lines. You can see the gaps, and the list of verbs is given: prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. As for example, if we speak of the meaning of attach, this is like tie something, connect. And if we say withdraw, is take away something. And you can see several abbreviations in the sentences. For example, in line B, it says 10 drops of CSF. CSF, it's given below. CSF stands for cerebrospinal fluid. This is a liquid
Can I answer?
inside, just a minute, inside the body. And line C, this is the point between L3 or 4. This is L stands for lumbar vertebra. This is also part of the body. Yes, please. What do you suggest to use in the first line, line A, with the stylet? Yes? That was.
Mark the stylet.
Will you repeat, please?
Mark the stylet.
Mark the stylet. I guess we understand the stylet is a kind of catheter or a tube, yes? And you mark the stylet. What are the other possible verbs? What other verbs can we use in this step?
I was of course confused between, I guess, prepare and mark.
Prepare is also possible, yes.
Yeah.
Teacher.
Yes.
Wash, maybe. Wash the stylet.
Wash the stylet. Yes, actually, it's possible, but normally, yes, wash, or when we speak about medical procedures, it's more commonly sterilize, yes? This procedure is, this manipulation is normally done. Okay, so let's leave it. And if we move to line B, about 10 drops of cerebrospinal fluid into 3 specimen tubes. The tubes are given here, the picture you can see. So this is for collecting some.
Doctor, can I answer?
Yes, please.
Maybe prepare 10 drops of CSF into the 3 specimen tubes.
Look, so cerebrospinal fluid is inside the body, inside the patient's body. And this is about just taking the body, this fluid out of the patient's body. So can we think of any other verbs here? Yana, what do you think?
Withdraw.
Withdraw, or if we speak
Maybe
about
drain.
Drain.
liquid, it can be drained.
Drain. Yeah.
Drain
drain.
10 drops. Because drops are very just little amount of something. Okay, line C, the point between vertebra 3 or 4 where the needle is to be inserted. So I guess,
Can I answer, doctor?
yes, please. Mhm.
Maybe it's attach or wash.
Before we attach or wash, we should
No,
find.
sterilize.
Yes, we will, next step will be to sterilize, but first, when we need to find this spot, this point. Yes, Ramil, what do you think?
Maybe teacher mark the point
Mark
between
the
left
point.
vertebra 3
It's
and
better.
4.
Yes, mark, of course. The next line is your
No,
hands.
no, doctor.
Yes. Mhm.
Your hands and put on sterile gloves. Wash your hands.
Exactly. This is the only just possible option here. Okay, now E, consent for the procedure.
Prepare.
That was
Withdraw.
the
Obtain consent, miss.
obtain consent on the previous slide. Okay, obtain consent from the patient for the procedure, and then F, the area of the patient's back. So we've marked the point for the needle to be, where the needle is to be inserted. And what should we do with this area, which we have marked on the patient's back?
Withdraw maybe teacher.
So this is the patient's back, yes, and we need to do some manipulation, some procedure with the needle and the patient's back and his or her vertebra, and
Attach.
Sterilize.
Needle.
sterilize, yes, sterilize the area.
Sterilize.
This is the rule. Before we do something, we should sterilize if it is connected with some kind of intervention into the body. Well, then line G, the equipment on the trolley. What should we do with the
Wash.
Prepare teacher.
Prepare
sterilize?
or sterilize. Sterilize.
Exactly, yeah. Mhm. Several options are possible. And the last line here, the manometer. Manometer is this is the manometer which shows the pressure of some liquid. So
Attach.
attach.
Withdraw manometer.
Attach the manometer, withdraw the manometer. Okay, yes, and now let us have a look at the correct options, the correct versions here. This is withdraw the stylet, drain 10 drops of fluid, mark the point, we were right, wash your hands, yes, obtain consent, sterilize the area, prepare the equipment, and attach the manometer. So if we have a look at these phrases, they represent the instructions for a procedure that we don't know. Let us just put these steps in the correct order. What will be the first step? The first step here.
Wash your hands and put on sterile gloves.
Okay, possible. Or what about preparing the equipment? Yes, I agree. First, we should wash our hands and put on the gloves. And then the next step will be what?
After preparing the equipment and washing the hands, yeah?
Yes.
Utilize the area of the patients,
Um,
maybe.
we need some equipment, some instruments, some medical tools.
Prepare the equipment on the trolley.
Yes. And before we start all kind of manipulations, should we obtain consent from the patient for the procedure?
Yes,
Of course,
teacher.
this is the
Yes.
first thing.
The first thing we should do, then we wash our hands, prepare the equipment on the trolley, and then what do we do?
Maybe we should mark the point between
Yes,
L3.
yes, now it's time to mark the point.
Then
Or
I think we sterilize the area of the patient body.
Mhm,
After
then
mark that.
yes, sterilize this area. Then
Then we withdraw the stylet.
before we withdraw the stylet, we should put it inside.
Inside, yes.
What is it?
Uh,
We sterilize the area and then we get this liquid out of the patient's body.
drain 10 drops of
Yes, yes, you are right. And then after we've drained this fluid out of the body, we should
withdraw it. Or
withdraw the stylet. And we've missed attaching the manometer. So we should attach the manometer somewhere where before the procedure. Yes, before we start sterilizing and doing these things. Actually, some steps are missing here in this procedure, but anyway, it can give us some just understanding of the process that is done, manipulation with that is done with the patient. What kind of procedure is described here? What is the procedure?
removing the toxic liquid from the back.
Removing, sorry, what?
Removing the toxic liquid from our back.
Toxic liquid. Okay. But there is information about vertebra. Yes. So this is actually, yes, this is, these are the illustrations and description of the procedure. This is lumbar puncture. So you can see procedure of taking fluid from the spine in the lower back through a hollow needle, usually done for diagnostic purposes, a spinal tap. So you can see that the needle is how the doctor should insert the needle to get this fluid, and you can see the posture of the patient during this procedure. Well, so yes, no, before we start discussing the final test, I would like you to, no, I would like you to, yes, to revise some just terms that we studied during this 5 weeks. And now let us just, it won't take us a long time. This is done, we'll be doing this in the form of a game, a quest. So imagine that we are just running in a maze, and our aim is to find the center of the maze. So can you see the slide?
Yes, miss.
Yes,
Mhm.
teacher.
So-
So correct answer is the correct route, as I understood.
We should choose the correct, yes, answer to the question to go the right way. And if you make a mistake, you might get lost. So the first hour, so we enter the maze and we should decide, should we go turn left or turn right? So we need to answer the question to give so to understand the definition, which says, which medical job involves implementing standard policies and procedures that keep the practice running smoothly? They supervise the facilities office staff, hire and train new staff members, and manage finances and budget operations. So, Ramil, where should we go?
Practice manager to left, because general practitioner is like a doctor teacher,
Yes.
which is like a general treatment.
So let's try to go left. Yes, we are inside. Now, the next definition, the next task. This is a person who greets and deals with clients and visitors to a surgery office, etc. Is it health visitor, receptionist, or practice nurse? Should we go straight ahead, turn left, or turn right? Your decision?
Receptionist. Turn left.
Turn left.
Turn left, receptionist. Okay. The next is, this is a doctor who treats patients with minor or chronic illnesses and refers those with serious conditions to a hospital. Is it general practitioner or midwife?
General practitioner.
General practitioner.
Okay, yes. And now the next is, this is a trained nurse who visits people in their homes to assist or advise the chronically ill or parents with very young children. Practice nurse or health visitor?
Health visitor.
Health visitor teacher.
Health visitor. Yes, you're right. This is a person, typically a woman, who is trained to assist women in childbirth. Midwife,
It's a midwife.
receptionist,
Midwife.
midwife, straight
Midwife.
ahead. Yes. And this is a nurse who visits and treats patients in their homes, operating in a specific area or in association with a particular health center. Practice nurse or district nurse?
District
District
nurse.
This is a registered nurse based at general practitioner surgery office practice, who works with their GPs to care for the patients seen
Nurse.
at surgery. Sorry?
It's practice nurse teacher.
Practice nurse. Let's check. Yes, you're right. This is a chronological written account of a patient's examination and treatment that includes the patient's medical history and complaints, the results of diagnostic tests and procedures. Is it presenting complaint or patient records?
Patient records.
Are you sure?
Yes.
All right, okay. This is the list and the description of the health problems and issues experienced by the patient, resulting in the attendance. Hospital number,
Presenting
complaint,
Presenting complaint.
or patient records. Presenting.
Presenting complaint.
Okay. Which condition do you associate with the sharp pain at the right side of the stomach? Is it appendicitis, tension, headache, or angina pectoris?
Appendicitis.
Sure. We should
Yes,
go
teacher.
straight. Yeah. Yes, you're right. And now, which condition refers to pain that radiates along the path of the nerve, which branches from your lower back through your hips and buttocks and down each leg? Is it ureteric colic or is it sciatica? Yes, we should choose turn left or turn right.
Maybe sciatica. I don't remember because
ishias in Russian? You choose sciatica, right? Or ureteric colic?
Mhm. Maybe you will give us a tips this time, teacher.
So the definition is given. No more tips. So I mean that we should just focus on this. This is a kind of pain in the leg, right? So because
Yes.
it radiates into your hips and buttocks and down each leg, because this is pain. So
Yes, teacher, it's sciatica. This time I'm sure because you're too.
yeah. If we click yes, you're right, sciatica. Which condition do you associate inflammation in the stomach, causing belly pain, indigestion, bloating, and nausea?
Gastritis.
Gastric.
Definitely gastritis.
So gastritis.
Gastritis.
Yes, congratulations. You found the center of the maze. So, and we've revised some medical terms. And now let's go back to our slide, which so about the test. So when you go to the when you log in at the Moodle site, you'll see the tasks for the current week. There you will find the presentation and so the test. So you will see the instructions. So the instructions, this is, it says that the test covers the topics and grammar structures of Unit 1 and 2 that we have just discussed during our classes. So the first week of the semester, and there are 35 questions in the test, and there are 4 types of questions. So most of the questions are multiple choice questions, where you have to choose only one correct option out of 4 or 5 given below the question. It means that there is a question with a gap, and you should complete the gap with one of the phrases which is given with this sentence. They are mostly grammar questions. Then there are some true-false questions. You should be careful with all the words. You should agree or disagree. There is a statement, and you say if it is true or false. Then matching questions when, for example, there are some medical terms and you click on this term, and in the menu you will see several options, several definitions for this term, and you should choose one of the definitions. It means you are given several terms, and each time you click on the term, you can see the same definitions. You should match each term with the correct definition. And select missing words. It means you will see a text, a short text, and with several gaps in the text. And when you click on the gap, you will also see the possible options in the menu, and you click on the correct option. Which better suits the place in this sentence of the text. And so at the end of the test, you should just click on, there'll be save button or something else. So the time for the test is 15 minutes. So it's just enough time. And now I'll go to Moodle site and open the test for you, and I'll change the settings. So it means this is just 10:30 Almaty time. So I'll open the test from 10:30 during I think, till 12 o'clock. And during this time, you should start just taking the test immediately now, because we should do this during our class time. And so when you start, you will see so the time countdown, which shows how much time you have till the end of the test. So this is it will be it should last no more than 50 minutes. And so you just click on the correct answers. That's it. When you have finished and submit the test, you will be able to see the score, how much point you get for the test. So this is the information about the test. So it will take me several